Good morning. I'm sorry. Good evening, everyone. My name is Jennifer Lee with Premier 360, and I'm so excited to introduce my co-host William Hung and our special guest Eliseo Tahanlangi. Is that how you say it?
Yes.
I know it's a tongue twister. So I'm really excited to introduce Eliseo today. He's been a registered nurse since 1993. He works in Level 2 Trauma Center in Pennsylvania. He's a nurse case manager in ER, med-surg, oncology, and telemetry units. He's board certified in case management as well. He's a licensed life and health insurance agent in Pennsylvania, New Jersey, and California. He graduated nursing school from Cerritos Community College in California with his wife, Victoria, who is also an ER nurse. And also your kids, right? Two of your kids?
Well, actually, one's a labor and delivery nurse, and the other one is in med-surg right now, starting a med-surg.
Oh, nice. So keep it in the family. So Eliseo also runs his business as a Medicare nurse navigator, where he enrolls, navigates, and provides consultations to Medicare retirees. So often I hear from a broker's perspective, but we'd love to listen to Eliseo's nurse patient side and why he also got into Medicare. So please welcome Eliseo, and don't forget to hashtag live if you're live and hashtag replay if you're watching replay, and tell us where you're viewing from. So welcome, Eliseo. So first, tell us about yourself.
Hi, Jennifer, and hi, William. My name is Eliseo. I've been a nurse since '93, and I started out in Cerritos College, as you had noted. My first job was at Downey Community Regional Center, and then
right there.
Yeah.
There.
And then my wife and I couldn't find a job for like 6 months. She went to get her initial ER training at Riverside Community. And then we both got the call from LA County USC, the old LA County USC, where they had the C booth, the square within the square, trauma, where all the knife and gun club victims went to. And she stayed there for quite a while. I went to other community hospitals, including Friendly Hills, which soon closed after I went to there. Then I went to Queen of the Valley or Citrus Valley Health Centers. And then we both ended up, in West Covina, correct. And then before we relocated to Pennsylvania, we were both at St. Jude Medical Center, right over there on the border of Anaheim and LA County.
Yes, that's where I live, close by. Most of my clients either go to St. Jude, UCI, or St. Joseph's, which changed to Providence now.
Yeah, so lots of changes, but we relocated to Pennsylvania in 2004, and we've been here since. It's the longest I've ever stayed in one health system here, which is about 45 minutes to an hour north of Philadelphia. The humidity stinks here. When you guys have your, when we went back in January and it was 70 degrees and it was snowing over here, it's you totally miss it. You just soak up the sun, especially when we went to the Long Beach Yacht Club, and it's sunny. But anyway, I work now as I've been working as an ER nurse, and then pivoted to a case manager in the emergency department. I was a ER nurse all that time, and my wife still is at another level 2 trauma center, which is in the same health system in Mainline Health. We've seen a lot. We've we're still at it. Again, a family of nurses. My late mother was a nurse at Bellflower, Kaiser Bellflower mostly. And it just kind of passed along. So our youngest at 22 just became a registered nurse. She passed the boards last Thursday, and she's been working at a level 1 trauma center in med-surg unit since January.
Oh, wow. Congratulations.
Yeah.
It's so funny because most Filipinos are either nurses or post office workers, I would say. And I actually have some close family friends that we have. The husband and the wife is a nurse. Their 2 sons are a nurse, and their 2 daughter-in-laws are nurses. So it's just a whole mess of nurses in the family.
Yeah. We didn't really know if the girls or any of our kids were going to follow our footsteps, but I think little by little they tell us that our conversations at the dinner table about what happens in the emergency department really, turned them to the profession. And yeah, our youngest one, Alyssa, is really excelling in that, and I think she wants to go to the emergency department as well, or ICU.
Oh, good. Yeah, I can never be like, I never in medical field. My family is like, we're just not those. We can't. Like, I mean, it's hard, the blood and everything, right, William? I don't know.
Yeah, I don't see myself working for like ER right in the front lines. But the interesting thing is that I did work for the public health department for 6 years for LA County. So I even though I did do the office work, I work for the division of HIV and AIDS. So there are some like very fascinating projects and research going on there too.
Yeah, back then in '93, it was really man, the LA County USC was hopping. In fact, they did a video on it. I think it was Code Black. There's actually a movie made about the residents that were really talking about the C booth or critical booth. It's somewhere on YouTube. I know that I watched it. It was pretty cool. It showed some of the administrators that were there, the nurses, and people that we work with. And back then, remember when the show ER really was new, some of the actors actually shadowed us. And I don't know, Jennifer, did you see my Facebook where I kind of did the video montage for my wife with the maroon scrubs?
Yeah, that was cute.
So when the first ER shows, they mimicked our maroon scrubs. And the producer and writer was also a physician. I think it was at, I forgot what local hospital it was. I think it was like Lakewood. But yeah, some of my coworkers also were, extras. They were doing some of the stuff, putting the IVs and walking around. And, I think it was Patrick, Hannah, and anyway, some of the other coworkers were extras in that. So it was really an interesting time.
I'm sure. Well, thank you so much for being a frontline worker. I mean, you're a hero, and so it's great. So let me just look at our viewers. Thank you, Tita Tino, for watching. Thank you, MJ, watching from Los Angeles. Thank you, Lydia, for watching. She's my mom. Thank you, Abby, for watching. She's in Eastvale, where I used to live. Let's see. Thank you for watching Lee Wang. Thank you for watching Lilia. Thank you for watching Jonah, RQ, and Sai. Wow, my husband's watching. That's sorry, just kidding. Okay, so Eliseo, what's your story, and what got you doing what you are doing today?
Well, after 20 years in various ERs, I kind of got tired of getting thrown by patients, spat on, and just a back-breaking pace. There's 12-hour shifts in the ER, and you can work various shifts, 9 to 9, 10 to 10. I was mainly working the 11-11 shift. That's not for the lazy nurse, because as soon as you walk in, you're running all the way until midnight, and then you just go home and crash, and you do that 3 days a week. And then I was doing all that overtime. Being flexible with those shifts, you just work overtime whenever you needed to take care of the family. So my wife and I work separate shifts so that there's always a parent at home. But then at some point, after 20 years, I had to go think about longevity. And then you would walk home, get home, and your back is aching and whatnot. And really, nursing has changed all these years. So I had to really think about what I was going to do next. And what I saw in our emergency department in my health system, I saw the case managers that just seemed to know everything, just seemed to, whatever questions that you threw at them, they knew a resource. And I was just fascinated with it. So I kept asking them questions and whatnot. And after a few years, when, there's just that last straw, you would come in and before you even put your backpack down, you would get 4 brand new septic workups. And those septic workups, patients are about, if you just did that on your own, that's takes about 45 minutes each. So can you imagine you have the 1-to-4 ratio and you're running and you're timed. And if they're, let's say, a pneumonia patient, you had to get everything done within 2 hours, strokes and whatnot. So the sepsis, it was really just hectic. So finally, I just said, things have got to change. So I went to apply for a case management position. I had no experience. And because I've had 20 years of experience, they said, okay, we'll try you out. Here you go. Trial by fire. They just told me this software, and like a true ER nurse, I delved into it and just hustled, learned, taught myself. And the main thing that I saw was a lot of questions about Medicare and insurance issues. And so I had to teach myself how to do, how to answer those questions, and also make sure that the patients were in the right plan, because it really affected the way I coordinated post-acute care. So I went down that rabbit hole. 2 years into case management, I went to get my board certification just to show my my proficiency in it. And at the same time, when I was getting my board certification, there was a lot of insurance questions there, and I just Googled it. I said, what's the best way to learn about insurance? And so I went to Kaplan Financial. Bought their course. I think it was $400 for the whole thing. And I studied.
Expensive.
I know. Well, I didn't know, so I got the book. I learned from that. It really helped me out on my board certification. And then so I got that in August, the beginning of August of that year. And then after I finished that test, I said, I learned so much about the insurance, I might as well take the test. So I took the same test that same month, and I passed it. So passed both. And so from there on, I said, there's something about this insurance thing. I was watching YouTube, and there's something about Medicare insurance, and I just need to know more. So continue to do the rabbit hole. And that's actually how you and I have met, because we are always in the same Facebook groups, right? And same training. And anyway, that's how we continue to see each other. And finally, we just decided to say hello virtually.
I know, it's so crazy how I've met so many colleagues and friends now that we've met through Facebook. It's crazy. But hey, the world's like that now. I mean, that's how you network with people and you grow your community, and it's amazing. Like I feel like, you know, a lot of people have helped me. I've helped a lot of people, and it's just a great community for me for positivity, and that's what I love. And
Yeah,
I'm sure
and it
that's to
yeah.
that, you know, and he probably has a whole big community with himself too.
Yeah. Like I said before too, everything's virtual, because back east, right now it's 9/16, and you're in California, right? And I'm talking to you and getting to know you, but there's some other people that I've met. Let's say, like, when I started out learning more about insurance, I joined some of the Facebook group, like the Soup, and that's where I met Malia. And Malia, when I was looking at the messenger, she and I were talking since 2017. And another nurse who was also doing some insurance somewhere in Colorado or something like that, told me about Malia. So I texted her and secure chatted her, and we've been talking since. She is the one that I would refer people who are needing some under 65 policies. And I've been referring here and there, and just, tagging her, because she knows her stuff. Right. And
Yeah.
so that's a resource that I use. I solely focus on the Medicare, with the Medicare supplements, or Medicare Advantage. And then it has just blossomed to other things in my wheelhouse, because of my position as a case manager. One of my unique selling proposition, or unique skill, when I'm helping out my private clients, is that I'm able to dig further into their medical records, and you're able to do a better discovery, because once you know their medications, you just know their health trajectory, and you know how to position some of the insurance products that you have to really. I really don't even have to sell, because I keep telling them that this is what I see with my patients, because I'm still working full time in the hospital.
Exactly.
And this is exactly the reason why I cannot help them, because they didn't pre-plan, or they had the wrong Medicare policy, or they didn't put enough planning into those huge gaps that the Medicare insurance didn't cover. So, and also with just knowing what they come into the emergency department, I know that they were going to come back and forth. And so I tell them, here's what's going to happen to you. And you need to think about this. And so some of them heed that advice, some don't. And unfortunately, then I really have a tough time trying to coordinate care out in the community because of that.
Oh no.
Yeah.
Well, let me just pause. Thanks, Martin Vertito, for watching, Sarah John for watching, Michael Pineda, Tonette, Michelle, Willigan, Evelyn, Trinidad, Marissa, Oliver, Malia's watching as well, Epifanio, Lori, Pam, Renee, Jennifer, Olympia. Okay. I think that's it for now. Okay, so let's get back. What do you see with the struggle in the industry today, and why Medicare is so important in that whole equation?
Listen, it's getting very complicated. There's so many half truths, misinformation, and I think what I'm doing, and that's what I'm going to encourage some of your nursing audience, the ones who are experienced, I think that you really need to not sleep on the fact that you need to know about Medicare. If the most practical way to start learning about Medicare is to memorize really Medicare.gov, and then because what's going to happen as people age, you're going to be the right now, the nurses are the most trusted professionals 19 years running. And so they're going to be a community resource. They're going to come to you asking your opinion. And unfortunately, when the age bracket moves over in the next 25 years to over 78 million baby boomers, their Medicare is going to be top of mind, and you need to practice on how to answer those questions and coordinate the care. So what I tell them, in addition, because I'm there full time, what I'm trying to tell you is not a movie, not a 2-hour movie. This is almost like Netflix live streaming of what's happening at the hospital, because there's a 2017 statistic that almost half of the healthcare starts out in the emergency department. That's the reason why I started feeling that the burden, because everybody's coming to the emergency department, whether they're admitted as observation or inpatient, or they just go home. There's touch points and trigger points in the emergency department that allow me to say, hey, watch out for this, because you're going to come back and you need to kind of watch out for that. There's in the current times right now, one of the great things that, let's say my wife and I were able to do and get rid of misinformation, is because we were front lines and we were in the emergency department. We saw everything of how sick the patients were. And it really scared my wife and I, after almost 28 years there, that we kind of were able to cross-reference. We were there, N95s, PPE, and everything like that, and getting all the information from out in the community. We were able to kind of put together our own opinions of what needs to be done. So we're all vaccinated, the whole entire family, because of that. We weren't privy to, just listening to what is out there in the media. We were actually hands-on, and we were able to see the effects, that it wasn't just, media hoopla.
Yeah, for sure. I'm sure there's so much misinformation out there. And then just from the insurance side too, I feel for my clients, because, most of these clients are seniors, and they get bills and they just think to pay them, and they're crying their eyes out because they think they have to pay these. And it's just, in navigating through the insurance companies, it's crazy. Like, sometimes their children help, and then even their children are just like, Jennifer, just help us, because it's too crazy. And I help navigate through that. I'm sure you do, just to help our clients, because it is amazing. It's confusing to very many, and so forth.
Actually, that's it brings me down to the rabbit hole again on the back end, because when I'm trying to coordinate care from the hospital, I go down, again, lack of a better word, the rabbit hole, as to what ways to pay for care do they have. The first thing that I ask is the VA benefits, as well as if they were lucky enough to start a long-term care insurance. Today, for example, I was able to see the declaration page, and I don't advise them without seeing the declaration page, and also the fine points the information that was given to them way back when, and they had to dig it out. But then because I didn't know more about a lot about the long-term care insurance, I had to go dig the information, watch the videos,
Yeah, it's
connect
not.
with.
I mean, people think it's covered and it's not. And at the
Correct, and
point
it's
when
and then
you're
there's different ways to start the process. Um, so I connected with, actually there's some actuaries that have connected here in California, as well as multiple ones on LinkedIn that have educated me, and I continue to learn from them so that I can better advise my patients. Um, the I stack their when they have a long-term care insurance, I stack their post-acute care services, and they really appreciate that. So
a lot don't though. And so that's where financial planning and health planning, retirement planning all come together before, you hit that catastrophic.
yeah, and one of the things that I would encourage the people that that's in your community is to really reach out to you, because they need to know that for their patients or their clients, and if they didn't know, at least refer them to you, and learn from you, and vice versa. If you go out there and grab all your the medical personnel and tell them about those policies, the hospital indemnity policies, the home care policies that kind of fill in those gaps, it would really help out. And that's what I'm finding out, that I connect with all the different financial planners, even some of the insurance agents, property and casualty, and other nurses, to really put together a team so that they can understand that, not only for their own retirement, but also to help out the patients in the long run.
Exactly. Let me see. Others people are watching. Adele Oy is watching. Marcus watching. Christine's watching. Who else? Mel is watching. May, Vera. So thank you for everyone for watching. What would you say your biggest success? Or well, first, William, do you have anything to add?
Not really. I mean, yeah, it's all about just like educating yourself about like insurance. I could tell you that I used to hate insurance with a passion, because as a young 38-year-old guy that's completely 100% healthy, it's like, why are you even trying to sell me insurance? But I learned that it's good to have some insurance. Whatever the right amount is, you can do what's comfortable for you. But it's good to have something, just so that if something were to happen, my parents and my loved ones wouldn't be left with nothing.
Exactly, because his parents, you is aging, right? And so
Right.
Yeah.
Let me tell you what we're seeing now. And in fact, I was just texting my wife. When I look at the emergency department, it's kind of glaring that age band is moving to the elder baby boomers. Looking at the first 15 patients, the ages were 99, 99, 99, 98, 97, 87, 83. And their children are in their 70s. So that is what we're dealing with right now when they're coming to the emergency department. And then I just had patients coming back and forth. So it's like you just cut and paste some of the, the information that they have, because I knew that, they just keep using the hospital because their health is just declining. And then, so if you don't pre-plan, to take care, to pre-plan that you're 70 years old and your parents are still alive in their 90s.
You have kids in your 50s.
That's exactly it. And I not, in fact, I just counseled another 72-year-old woman who had a 95-year-old that mother that she just can't take care of her anymore. And then her husband had some memory issues. So she's in that sandwich. Her health is moderate, but once her mother dies and she has to take care of her husband, and this, and the cycle goes on, but then your later part of your life is taking care of multiple generations if you're the primary caregiver. So if you didn't pre-plan and talk to Jen, then that is the difficult part on my end as a caregiver and care coordinator, that I can't put enough resources out there to help out.
Exactly. And Eliseo, what would you say if you had to leave with some few words or advice? What would you say to our audience?
Make sure you plan. It's not necessarily about the finances, but really try to find a nurse out in the community, because they're the ones that have muddled through the healthcare maze, and they're a great resource. For me, I live it. RN advocate.
Well, that's nice, because I do my horn as an advocate for my clients, so I get that. I totally get that.
And then also network with other nurses, because I just don't know everything. And I was privileged to also be one of the 39 contributors for a brand new book that was just put out, the Life Care Management Handbook.
Very nice.
And I was able to put in my 2 cents there. It's a never-ending learning process. And to top it off, it's added complexity with just learning about Medicare and all the insurance regulations. But it's helped out by working with, connections like you and everybody else that's on those Facebook groups that I seek out.
Well, thank you. Thank you for your time. Thank you to you and your family for being frontline workers. William, is there anything you want to share, or any updates with you that's been going on since our last live?
Well, I'm still searching in my life journey. It's been a long journey for me. So like I went through entertainment. I quit my government job working for public health. And now I go into being a full-time professional poker player. Who knew? Who would have thought? I know, public health and administrative assistant turned professional poker player. But it's not about that. It's not. It's part of the journey, because it's like you, Eliseo. You evolve as well over time. You work in the front line, but you didn't know you're going to get into the insurance until you feel, oh my God, there's so much to learn. There's so much to give. So yeah, my path is also continuously evolving.
Yes, I mean, that's all. It's all about growth and just moving forward and being a better person, just never stopping, right? For all of us. Just updates for Premier 360. We finished annual enrollment for Medicare just recently, 31st yesterday, but year-round enrollment for anyone under 65. So it's been crazy still, which is great. So business all around. We are expanding this year. So if anyone knows any agents that want to do Medicare, let me know. Specifically, we're looking for Spanish and Vietnamese speaking agents, because it's really needed in Southern California as well. But I thank both of you guys. I thank you, William and Eliseo, for being on this live today. And if you guys have any questions, feel free to chat with William or Eliseo or me, and we'll definitely direct you to the right direction. And the number one key is planning. You just don't want to be stuck in that rut when something catastrophic happened. And at that point, there's really not much Eliseo, the nurse, could do, the Medicare Nurse Navigator could do, or someone like me that could help. So thank you again, guys. You have a wonderful night.
Take care.
Thank you, Jennifer. Thank you, William.
Bye-bye.
Have a good night.